discussing chemical peels and skin of color, one of my favorite topics. I explain to doctors that are looking for advice that I do chemical peels on myself basically once every month to once every 6 weeks. They help me with my texture of my skin, as they help everybody, the tone of their skin, they help with acne, and they help with fine lines. There is not a place that you can't do a chemical peel on the body, on the face, on the neck, on the chest, on the arms, on the back, on the buttocks, on the legs, even on the feet. The only place I have not done a chemical peel is probably the intimate areas. I tell my patients that the chemical peels are something that have to be repeated, and this is what I tell doctors to tell their patients. The issue is that if patients come into our offices as physicians and they don't have a realistic attitude of what to expect, they're going to think that one chemical peel and they're going to look like a movie star. It's a series of treatments to achieve the best results. Looking at what I really specialize in my private practice with, I do a lot of superficial chemical peels and I do a lot of medium depth chemical peels. Sometimes you have to make allowances. If people are too sunburned, if they're too red, if they're not going to put on sunblock, if they're not going to listen to the post care, we as the doctors have to be the police people of who we're letting in the gate for chemical peels. And that's really all there is to it. So I explain to doctors when I'm lecturing all the time that they have to look at the patient, assess the patient. If the patient is a very heavy smoker that tans, that you know is not going to get great results from a superficial peel, the first thing you need to be talking to them about is more of a medium depth peel. If the patient is the type of patient where you're looking at their skin of color and you're seeing it's blotchy, it's uneven, they're picking their skin all the time, they're uncomfortable, they have 3 pounds of makeup on, you're talking about a medium depth peel again. Now, this goes to all patients, including patients that are not skin of color. If you're looking at a patient that has a little slight bit of hyperpigmentation, a little slight bit of acne, a little slight bit of fine lines and wrinkles, maybe you want to start with a more superficial peel. Patients want bang for their buck. We as doctors have to produce the bang for their buck. So you have to advise them of where to start and where to go. Many times I'll start them superficial when I know they want to jump to medium as soon as possible, just to see how their skin is going to react. In addition, I make sure, as the physician, that I tell my patients that they must put sunblock on an SPF of 30 or more every single day, rain or shine, January through December. I tell physicians that I'm lecturing to that that is what they must advise their patients to do. And the patients have to reapply the sunscreen consistently. That is every 2 to 3 hours. There are different powder puff sunblock brushes that can be used that are fabulous for that, and some people don't mind reapplying the creams in the middle of the day. It's whatever they want, but they definitely need to reapply it. In addition, there's a good skincare regimen that I properly tailor to every patient. Men are different than women. Men are going to deal with 2 steps or 3 steps or possibly 4, whereas perhaps some women can deal with 5 or 6 steps in the morning and in the evening. So I tell my patients the best skincare is the skincare you are going to use. And we as doctors need to adhere to that principle. So if a patient tells you they have 4 kids and they're working full time and they have 2 minutes in the morning and they fall asleep at night with their makeup on, you're not going to give them a complicated regimen, because then they're going to fail their skincare regimen and they're also going to fail their chemical peel regimen. So we have to kind of, I believe in meeting them where they are. Going back to chemical peels for a second, in terms of cautionary tales, you want to make sure as a board certified dermatologist or plastic surgeon that we're prepared to treat who comes into our office. So that is staying up to date with the latest of everything. If a patient has a huge cold sore that looks like a sail on their lip, maybe you're only going to peel the upper part of their face and you're not going to peel the lower part of their face. You're definitely going to give them a prescription for Valtrex or something like that to get that cold sore walking away. But you're going to be more careful in those cases. If the patient has a superficial infection, I had a patient that came in maybe a month ago with a waxing burn. You're not going to treat that area with the waxing burn right away. You're going to treat it later. You're going to be able to help it later. But right now, maybe what they need is topical skincare. So we really need to put our medical judgment, even though these are relatively benign procedures, anything can go wrong. In addition, I tell my patients not to pick at the flakes when their face is flaking, because that can cause undue irritation, and in some cases it can cause scarring, and that's the last thing that you want. You're trying to treat their skin, you're not trying to take away from what they had when they came through the door. Finally, I advise all of my physicians when I'm lecturing, you have to take good pictures. If the patient doesn't want you to take baseline photographs of them, you may not peel them. For that matter, I would recommend maybe you give them some cosmeceuticals, but you may not even touch their face. It's just not worth it for you not to have baseline pictures and for the patient to come back in complaining about an issue that they had in the past that now they're ascribing to you. So we have to protect ourselves as physicians, and that's key also. In terms of at-home peels, there are a lot of masks out there. There's a vitamin C scrub that's exfoliating that's very, very, very popular that I highly recommend. There's glycolic acid masks on the market. Those are at-home chemical peels. So I recommend my peels in the office and that they do those peels at home so that they can have a combined effort. Specifically concerning chemical peels in skin of color, there were a lot of fallacies surrounding what skin of color could be treated with and what would be accomplished with working with skin of color in chemical peels. The reality is that most peels that are on the market, well, not most, I'll say some of them, are really good for all skin types, including skin of color, and some are not good for skin of color at all. Some of the very deep peels are not good for skin of color at all, and they'll lead to actual depigmentation, that is removing pigment from the skin permanently, which is not what we want. We want to even out the skin tone. So the superficial peels and the medium depth peels, you need to check with the individual manufacturer and make sure that these are being marketed for all skin types. I recommend for the physician when they're just starting off in their private practice to go slow and to do the superficial chemical peels on staff members, on family, on friends. And if you are a Caucasian doctor, perhaps you want to do a chemical peel on, the back or the shoulder of a friend of yours that has skin of color before you try it out on patients with skin of color. So you want to check with the manufacturer and go slow. The same goes, but twice as much, for medium depth peels because they are stronger, and because it's a medium depth peel, unfortunately more can go wrong. So you always want to start off slow, but you want to make sure from the marketing aspect, from the company, that they're good for all skin types, and then you want to start off in your practice with your staff, with your friends, before you move to the general public. And those are kind of cautionary notes for skin of color.